Let's start with the do's. Do wash the wound extensively with tap water and just a gentle, non-scented soap. Do make sure that any debris, foreign material, metal, or dirt is removed. You might have to scrub gently. Do use over-the-counter antibiotic ointments. Bacitracin is a good example of an antibiotic ointment that can help prevent an infection from spreading. If a wound is bleeding a lot, do find a clean cloth or gauze and apply direct pressure with just 1 or 2 fingers directly over where the area of bleeding is happening. Hold this pressure for at least 5 to 10 minutes. Although it's tempting, don't take it off to sneak a peek. Keep that pressure continuous. If the bleeding continues, do call 911 or consult your doctor. Don't use hydrogen peroxide to clean a wound. It may cause more damage or prevent healing. Just plain tap water and a gentle soap is just fine. Don't use Neosporin. Up to 25% of people develop a local reaction to Neosporin. It can be difficult to tell this apart from infection, so just stay away from it. Don't use household superglue, thread, or needle to close a wound at home. These are not the same as the skin glue that's used in the hospital and not the same as the suture material. This may cause infection, worsen the injury, or prevent healing. Don't delay seeking help if the wound is serious. Wounds sometimes can't be sutured after 24 hours and are at increased risk of infection if the care is delayed. You should go to the urgent care or see your primary care doctor for cuts that are gaping or deep and the edges won't come together. Wounds that look dirty and have pieces of dirt or metal in it, especially if you try to clean it at home and it will not come out. Any wounds associated with animal bites, even if it's your own animal. These sometimes require antibiotics or further immunizations. When should I go to the ER? You should go to the ER if the wound is very large and deep and there's underlying tendon or muscle that's exposed. Sometimes these wounds are more complicated to repair than they might appear. Sometimes a child might require special medication to make them sleepy and more comfortable. This is called procedural sedation, and it's not the same as general anesthesia. Please do not eat or drink prior to going to the ER if this is the case. If the wound is large and is around the joint, especially the hand or a knee, you might need to go to the emergency room. If there's an obvious deformity or there's a bone sticking out through the cut, please go to the ER. If you're having a hard time moving an extremity with a cut, like the hand, or if there's numbness or tingling in that extremity. If the cut goes through the entire length of the lip or on the lower outside of the eyelid, even if those are small, they probably need to be evaluated in person. Any cuts through the head that are associated with any sort of head injury, such as with a fall, these need to be evaluated in person. Or if your child hit their head and passed out. If your child has a bleeding disorder like hemophilia or von Willebrand's, even a minor cut can be dangerous. This is especially true around the joint or around the head. Please seek help immediately. Just pinch below the bony bridge of the nose on the soft part of the opening of the nostril, like this, very firmly. Do not let go for at least 5 to 10 minutes. As tempting it is to stop and peek every few minutes, it's best to keep the pressure directly on and not let go. Older kids can likely do this by themselves, but younger kids may need some assistance. Lean forward while pinching the nose to avoid the blood going down the throat. The blood can be very irritating, cause nausea, abdominal discomfort, and vomiting. Also, don't shove anything inside of the nose. It's okay to hold tissue around the outside, but not on the inside. If the bleeding doesn't stop after 10 minutes of continuous pressure, or if the bleeding is from an injury, your child has a bleeding disorder, please go to the ER for evaluation immediately. It's understandable to feel panicked or unsure of what to do when your child's in pain, but don't panic. First Step Health doctors are here 24/7 and able to provide care via telephone or video for cuts, scrapes, or any other medical concerns you might have. Just go to the app, log in online, or give us a call to talk to a doctor in a matter of minutes.